Heard of type 1 and 2 diabetes, but what about type 1.5? I spoke with an internal medicine doctor at Ochsner Health, raising awareness during this National Diabetes Month to explain the more rare diagnosis.
It's important for doctors to be able to diagnose what kind of diabetes patients have to be able to treat you properly. Type 1 is usually found in younger patients. Type 2 is usually found in older people. But what about those people who fall somewhere in the middle by age and symptoms? Those patients might have type 1.5 diabetes or latent autoimmune diabetes in adults, LADA for short.
They weren't old enough. They weren't in their 60s. They weren't heavy. Most type 2 diabetics are a little heavier. And so then these type 1.5s, they're usually not quite as heavy as the type 2 diabetics, and they're a bit older than the teenagers. They're more in the 30s and 40s.
Because symptoms often appear gradually, it's commonly mistaken for type 2. Studies estimate that 2 to 12% of adults diagnosed with type 2 diabetes might actually have LADA. Unlike classic type 1, which develops quickly and often in childhood, LADA develops gradually in adults, usually over months or years. So what are the symptoms? Dr. Joseph Hannigan with Ochsner Health Center says you'll feel fatigued.
But then combine that with maybe family history of diabetes or other symptoms such as urinating frequently and thirst. The way the body tries to get rid of sugars is when it gets very high, the body tries to urinate out the sugar, and then water follows that. So they're urinating often, and they're very thirsty because the water has left and they're dehydrated.
Medicating type 1.5 diabetes can be less straightforward than with types 1 and 2. Awareness is important in Louisiana, where about 14% of adults have diabetes, according to the American Diabetes Association, significantly higher than the national average.
Type 2 diabetics are getting younger and younger. We're seeing 25-year-olds with type 2 diabetes, 13-year-olds. They're eating a lot of processed food, drinking a lot of sweet drinks, sodas. You know, some patients you hear drinking 10 sodas a day, eating Pop-Tarts for breakfast every day. I have 25-year-olds that test and are diabetics. And honestly, one was very muscular. You look at him, he looks like he's in great shape. His A1C was 6.5, which is diabetic level.
But all types of diabetes can be treated and managed.
Most people recognize that sweets are high in sugar, but what most people forget is that starches turn to sugar. So that white rice that we like to eat here, and the white potatoes and white bread, that's all very processed, that turns right to sugar in our bodies. Better choices would be, if we could, sometimes eat more brown rice, more sweet potatoes, and more brown whole grain bread, like whole wheat bread.
And Dr. Hannigan says with an early and accurate diagnosis, most people can manage LADA, that type 1.5 diabetes, effectively and live healthy, active lives.